Good afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely. It may be due to chemicals in certain food, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at a time. 60% patients are in the age group of 20 to 40 years. Incidence is higher in older age group. Urticaria is classified as acute and chronic, but most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, and how and what kind of test is required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Archit Agarwal. He has a vision to provide best care for skin and health patients with latest advancements and technology at reasonable prices. He has years of experience in this field, and his skill and compassion has made a tremendous difference in patients' life. He is currently practicing as a dermatologist at KDC Clinic, Faridabad. A warm welcome to Dr. Archit Agarwal. It's a pleasure, doctor, to have you with us today. We are going to discuss about on a very important topic, which is the management of urticaria. First of all, I would like to ask you, what is urticaria?
See, urticaria is a medical term. The common term is hives, or
Right.
even common term is allergy. So, more or less, it is the same thing. All of this means same only. These are elevated reddish to skin colored your marks or the lesions on the skin, and these are itchy in nature, and sometimes they are associated with your swelling of the eyes, swelling of the lips when they are severe, and normally they tend to fade within 24 hours. Like suppose we have some patch over the hand, and that will fade within 24 hours. There might be a newer patch within that time or after that time, but that patch generally does not stay more than 24 hours. So that is urticaria.
Okay. Doctor, now that we know what is urticaria, can you please tell us what can be the cause of it?
See, suppose this is the body, so causes might be outside from the body and it can be inside the body as well. So outside the body, anything under the sun can cause urticaria or allergy. So it might be some medicines that you have recently changed, or some hair dye that you have applied, any pesticide or any color that your wall colors, you know, and it might be dust or seasonal changes as well. So anything that you have changed in your diet, and so even insect bites or sun, any physical stimulus might also cause urticaria. And sometimes the cause is within the body. So God has given us immunity or immune system that is to protect us from external infections. So sometimes that gets confused and starts creating allergy against the body itself, and that is the case where the allergy is coming from inside the body. And as you had told in introduction as well, there are some cases where we are unable to tell the cause in spite
Right.
of all the tests. So these are called as idiopathic cases where we don't know what is the cause, but symptoms are present similar, like hives and allergy, itching. Yeah.
Right, right. Doctor, we know that skin is a very complex subject altogether. So, in case of urticaria, how does a patient know in the first stage? Like, what can be the first visual of the occurrence of urticaria in our body?
So, as we were telling earlier, urticaria first visual might be somebody is getting reddish, elevated skin in the form of patches with itching, and sometimes and generally, as I was telling earlier, that the patch does not tend to stay for more than 24 hours. This does not mean that the allergy will subside in 24 hours. I am telling that allergy will stay for long time, but that patches keep on occurring and going. It won't stay for the one patch won't stay for more than 24 hours. And
Okay.
this is the initial picture. And sometimes it is, if it is very severe, then we might have our swelling of soft tissues like swelling of the eyes, swelling of the lips, even the swelling of genitalia.
Doctor, is this anyhow very serious? Is this a serious disease?
See, urticaria as such is not serious. It is more distressing, to be very frank. And but in very rare sub patients, some subset of patient very rarely might get that angioedema, the swelling of the soft tissues like swelling of the tongue, swelling of the throat, and that might cause difficulty in breathing. And that is the scenario or the case where it becomes very severe or
Right.
serious.
Right. So, well, viewers, all the people who are watching us right now, हम हमेशा आपसे एक ही बात कहते हैं कि इनिशियल स्टेज में आपको शायद उतना दिक्कत ना हो या प्रॉब्लम ना हो, पर अगर आप उस चीज को रख के रखेंगे और उस चीज को और बढ़ने देंगे तो डेफिनेटली वो सीरियसनेस की तरफ ही बढ़ेगा, चाहे कोई भी बीमारी हो. सो आवर फर्स्ट सोल्यूशन इज विजिट योर नियरेस्ट एक्सपर्ट. आप अपने करीबी एक्सपर्ट के पास जाएं और अपने जो भी समस्या हो रहा है, जो भी प्रॉब्लम हो रहा है, उसका जांच करें. डॉक्टर विल क्विकली मूव ऑन टू द नेक्स्ट क्वेश्चन. आवर नेक्स्ट क्वेश्चन फॉर यू इज, what are chronic urticaria hives and how will they go away?
See, acute urticaria is, you are asking about chronic urticaria. First, I'll tell about acute urticaria. Acute is
Right.
anything that is duration less than 6 weeks. So, if your disease subsides by itself or with medication within 6 weeks or 1.5 months, then it is a small urticaria or acute urticaria, short stay urticaria. When your symptoms of urticaria like your rashes, hives, swelling, your itchings, and persists more or less daily or multiple days a week for more than 6 weeks or 1.5 months, in spite of the taking medication or in spite of the therapy, then this urticaria is considered as chronic urticaria or long-standing urticaria. So symptom wise, it is similar to acute urticaria or short urticaria, but and treatment is more or less also similar. But the causes of this chronic urticaria is mostly internal. The autoimmune cause that we were discussing earlier, this is the main cause for chronic urticaria, whereas the short urticaria or acute urticaria is mostly from the outside.
Doctor, how can we, how can that be treated? The chronic urticaria, how can we treat that?
See, anti-allergics or antihistamines are the mainstay treatment for chronic urticaria. And sometimes, if the symptoms are not getting subsided, then we increase the dose of anti-allergics or we add some other medications. And first thing that, because it is a chronic thing, one thing that patients are bothered about is whether this will go or not go. So
Right.
it will completely subside, but it might take a very long time for the body to completely get rid of it. And that's why the medications have to be continued for a longer time. And more or less, this chronic urticaria, there is a graph like this. Suppose today, 100 patients we have diagnosed with chronic urticaria or long urticaria. And if we see them, these 100 patients after 2 months or 3 months, So around one fourth of them will not have any more symptoms after 3 months, but still 75 or three-fourth of them will have the symptoms. So that the urticaria is cured only in one-fourth patients in 3 months. And if we follow up them for another 3 months, then another 25-30 patients out of those 100 will get cured. So and if we follow them for another 6 months or 1 year, then most of them will have cured, but except for few. So as the time progresses, as the body gets the time to heal, so the number of patients with the chronic urticaria will have the cure or relief from the disease. So till that date they get cure, they'll have to continue with the anti-allergics.
Right. Doctor, we know that in the case of all the diseases, if you leave it untreated, it might, go to a worst condition. So what in case of urticaria? What can the situation be in case of urticaria if left untreated?
Yes. See, if urticaria is untreated, first, you won't be able to sleep properly, and that will result in so much lethargy and so much irritation throughout the day. And the productivity of the person will go down, and sometimes he might become very severely distressed, or even due to the sleep disturbances, there might be some psychological impact to the patient. And due to the itching, there might be chances of boils or infections, because due to the chronic scratching, they are more prone to develop boils or other things. So, and as very rarely it might become very severe, where they have swelling of the soft tissues like eyes, lips, and throat, and it might result in your respiratory difficulty. So it has to be treated with time and with proper precautions, and gradually with proper care and proper qualified care, this should not become a problem for the patient.
Right. Well, I believe viewers, you have got your answer. For all the viewers who are worrying right now, the only solution that is present, that is available for you, is visit your nearest expert. Doctor, we move on to the next question. The next question is, as we know that most of the diseases are caused by stress. So, has stress any relation or anything to do with urticaria as well?
Yes. So, see, somebody has rightly said that everything is controlled by brain. So, what
Right.
stress does is it causes a lot of chemical secretions inside the body, and there is a threshold for itch. So, what is itch? Itch is a desire to scratch. We feel the urge to scratch the skin. That is itch. So there is some irritation in the skin that causes us or causes that desire to itch. So when the patient is stressed out, so the threshold for itching is reduced. So the patient will feel more itchy. And once the patient starts scratching, there is a vicious cycle that once he scratches, there is more chemical secretion that will result in more itching. And again, he will scratch and become more itchy. So this is called as itch scratch cycle. So stress aggravates urticaria, and not only urticaria, anything, all the allergies are aggravated by stress, and in turn the allergies causes stress, so it is a vicious cycle. So uh, one should be away from stress as much as possible, and even relaxation therapies and yoga therapies have been proven to culminate or stop the urticaria symptoms to an extent.
Right. Doctor, talking about stress, we also know that stress has got to do a lot with our tiredness. It might not be physically, but it can be mentally. So, has tiredness, why do we usually get tired during, when we have urticaria, or do we get tired when we have urticaria?
See, there are two reasons for this. One is sometimes the patient are taking sedative medications for urticaria. It is a common belief that all the anti-allergics are having some sedation or they are having some sleep, increase the sleep. But this is
Right.
not today. Not true today. Earlier, the medications that were used for urticaria were sedating or they were having more sleep. And sometimes if the patient goes to the pharmacy and normally the available over the counter medications like your Atrex or your cetirizine or levocetirizine, whatever is commonly available for allergy, these are normally having some sleep. So that is one of the reason. And secondly, again the sleep disturbances. The patient will have some sleep disturbance at night, and that because the sleep is not completed at night, he'll feel tired or he'll feel sleepy throughout the day. So these are the main causes that patient feel tired or irritated throughout the day in urticaria.
Right. Well, we will move on to the one of the main question for today's life. Doctor, what are the dietary precautions, the do's and don'ts for the patients for urticaria? Because we know that our diet, our lifestyle has got to a lot with a wholesome, development of the body. So, what can be the dietary precautions?
See, first thing is that anything that causes allergy to me might not cause allergy to you. So
Right,
it is, yeah. So that is a thing that varies from one person to another. But still, there are some certain things that are commonly known allergens in many of the patients. And some of them are nuts. Nuts like groundnut, your dry fruits, these cause increases the allergy. Your few items of non-veg like fish and egg, they are known to increase the allergy in most of the patients. And apart from that, spicy food, very spicy food or very chatpata food, that also increases your allergy. And even your added preservative in the chips or momo or chutneys in your chow mein noodles, so that also increases your risk for increasing itching or urticaria. So these are the
right,
common things. But sometimes if I am having allergy, if I am vigilant, I get to know that this particular thing, this chutney or this achar is causing me allergy, and then I tend to eat less of that or I won't eat it completely. So that is a hit and trial method that patient get to know about his whatever he's eating or his routine. There is also called as something called as urticaria or dietary diary. So from morning to evening, whatever the patient is taking, he'll note down everything in morning, afternoon, evening, and he'll give a score to himself like whatever his symptoms of the rashes or itching, and gradually he'll think about it, that anything that is triggering it on few days that he's taking or he's having. And if you see the Western journals or Western literature, no, they are stressing more about alcohol, cheese, wine. So these things, I think we people don't take much. Here, more
right,
of spices, more of your additive colors. These are more important.
right. Yeah, I totally agree with all the words, all the things you have said, doctor. We, with time, we have a tendency of adapting the culture which does not belong to us. And somehow that is causing all the trouble in our body. Our ancestors have already mentioned कि आप जो खा रहे हैं उसी में आपका दवा है. बट वी नेवर ट्राई टू अंडरस्टैंड दैट विच इज द रीजन ये बीमारी इतनी बढ़ती जा रही है और इतने प्रकार की बीमारी इतने सारे एज ग्रुप में हमें देखने को मिल रहा है. सो यस यस डॉक्टर, यू आर सेइंग समथिंग.
No, no, it is pretty prevalent, common now, urticaria. So you're true. Yeah.
Right. Again, speaking about urticaria, we are talking about this condition which we get to see very commonly in most of the people who are around us, or maybe we ourselves are suffering from it. Doctor, please let us know, is this somehow, can this be carried out, can this be hereditary?
Yes, urticaria in most of the cases is acquired. It is due to
Mhm.
our surrounding things, but there are very rare variant of hereditary angioedema. The angioedema is something very severe allergy. Normally that presents as swelling of the eyes or lips, and that is one in a million. Once in a life of a dermatologist, he sees a case of that. So just for the sake of completion, I'll tell that yes, very rare chance of it being hereditary, but generally speaking, it is not communicable, or it is not inherited. Urticaria is not inherited. Uh, but scientifically, yes, there is a very tiny possibility that symptoms of urticaria presenting as angioedema, the swelling of the eyes, and so they'll give you history that they had their grandfather, grandmother, or they had their uncle, auntie who had this allergy, and any like even casualty earlier in their family due to this disease, and they are generally aware of it, and that is the
Right,
very rare variant I'm talking about.
right. Uh, as we have already mentioned in the initial stage of today's life, that because it's about skin, there are many things which are not proved, which does not have any conclusion to it. So yeah, there can be possibilities. So doctor, for all the people who have seen someone in their family having urticaria, how can they prevent themselves from having one?
See, first, it is not like if my mother is having urticaria, I'll have the urticaria. It is not a communicable thing. So it is not like if one of the member of the family is having urticaria, the other people will start having urticaria. Because urticaria is acquired, it is the allergic response of the body to external or internal triggers. So
Right,
we have to identify the triggers if possible, and remove them from our vicinity, and we have to take anti-allergics in consultation with dermatologist. And one of the what conclusion I have come after treating patients for urticaria for 5 years is that they are very scared of medications. So if suppose I am a patient and I go to the doctor, and the patient doctor prescribes the medication for 7 days, and if I am taking the medication only for 3 days and my symptoms are completely relieved, and I'll have a tendency that now the disease has gone and I'll just stop the medication. I don't want to become an addict of the medication. So
right,
as soon as I stop the medication, the symptoms will reappear because that is in the blood. It does not go so
right,
quickly.
right,
And then the patient comes back after 7 days that the doctor, the symptoms had subsided. I stopped the medication and now the symptoms have come back. So what to do? So we again start the medication. So as we were talking that acute and chronic urticaria, that will take 6 weeks or more than 6 weeks to subside completely. And that is why slowly tapering the medication or in consultation with your dermatologist is important, and not just stopping the medication once your symptom subsides is not the this thing. And people have to the main scare what thing scares the people most is that they'll become addicted to a medication throughout their life. It is not like that, as it is a common belief that any skin disease is incurable. Skin diseases, skin, once anybody is having skin disease, they'll uh, uh, get the medication throughout their life. It is not the case. Only in the patients with chronic urticaria or your chronic allergy or long-standing allergy, they'll have to take the medications that are that do not have any side effects for little longer time, maybe few months. But in acute urticaria, we can stop the medications in 1 to 2 weeks, 1 to 2 weeks. So that is what has to be educated to the patients, that do not shy away from medications. They do not give you any side effects, particularly the newer ones that are available in market. as the earlier ones had sleepiness or sedative action, today modern anti-allergics don't do have that.
Right. Again, on the initial part of today's life, we have also known that self-medication and self-treatment can be harmful for you. So we are letting you know again and again कि please अपनी जांच खुद ना करें. जांच करने के लिए हमारे experts मौजूद है. So please visit your nearest expert. Doctor, I can see few questions coming up from the viewers. Shonaya asks, how can I prevent itching and discomfort associated with urticaria?
See, so first thing is that taking an antihistamine or anti-allergic as prescribed by the doctor will prevent the itching, or it will control the itching to a large extent. In addition to that, there are some measures like applying calamine lotion, or that is soothing effect. So that can be applied on the hives. But if not, if you are not taking the oral medication, that will give you only short-term relief for 1 to 2 hours. And taking a bath in the cold water or little cold water will also have a beneficial effect, because once you are taking hot water bath, that increases the chemicals in the skin and that increases the itching. So cold water will again have your relieving effect on your itch for a short period of time. And apart from that, avoid triggers. Any triggers that you see, stop scratching your skin. So this itch scratch cycle, it says that if you're scratching your skin continuously, you are creating the allergy for yourself. So
Right.
just dab it with your hand, don't scratch it, and apply ice in very itchy areas. So that those are the things that you can do initially for your controlling your itch.
Right. Doctor, we have another question coming up from Pooja. Pooja asks, are there any potential complications associated with chronic urticaria?
Complications, one thing is only that this one, your respiratory, this thing. If somebody is unable to take breath due to the swelling of the throat in severe urticaria or angioedema, that can be fatal. That can be very serious. So that is one thing. Other thing is complications, like very minor complications, like somebody can have a secondary infection, somebody can have boils due to scratching, somebody might feel feverish. That's not a complication, that's a symptom. So
Mm-hmm.
somebody, if they're having severe allergy all over the body, they'll feel feverish. And so those are only that angioedema part is the complication.
Right. Doctor, we have the next question coming up from John. John asks, are there any over-the-counter medications I can take to elevate symptoms? And if over-the-counter medications are right to take?
See, obviously we are Indians. We are not Americans. So here the things work differently. So how much ever I advise, don't self-medicate. Even if I am a non-medico, if I am not a doctor, and if I have allergy, first thing I'll do is I'll ask my mom. I'll ask what to do, or I'll ask my friend. Then I'll go to the chemist shop and I'll ask him. Then he'll tell, take this. If it is not working, then I'll see the doctor. So this
Right.
is how the things work here in our country, and it's okay. So see, some common anti-allergics that are available over the counter are Allegra. It's very famous name. There are some others. Uh, but you can take anti-allergic like twice daily for few days. If your symptoms are persisting, then you need a proper plan, because otherwise you will be confused. You'll again and again visit that over-the-counter medication. Sometimes your symptoms will subside. Sometimes they will not subside. You'll be confused what to do. So you need a proper plan, and you should meet a nearby properly qualified dermatologist for your proper care. And it's okay if you are somewhere outside, uh, if you are the symptoms are very short lived, you can take anti-allergic from over the counter like fexofenadine. If I'm taking the name of the salt, morning evening 120 milligram you can take for few days. If it does not subside, then please do meet a doctor.
Right. Doctor, the next question is from Kirti Kapoor. She asks, can I exercise or engage in physical activities with urticaria?
Yes. So urticaria it aggravates with exercise. And so if your urticaria is adequately controlled with the medication, then there is no risk of exercising. You might exercise as how much you want. But if your urticaria is not adequately controlled, then it will get triggered with exercise because of the chemicals released during the exercise. So you might need to avoid exercising for a few days till your medicine starts acting. And there is a variant where the urticaria is only by the exercise. It is not by some external food, or it's not by internal allergy. It is just by the exercise. So in that case, also medications are advisable.
Right. With that, viewers, I believe we have got all our questions answered regarding urticaria. And that was Dr. Archit Agarwal for us. We thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers, and I'm sure they all will use this information to prevent themselves from the near and also their near and dear ones from getting urticaria. And in case if they get to see some symptoms, they now know what to do instead of self-medication, and it's better to approach nearby dermatologist. It's great to hear from you, doctor, and we look forward to many more such sessions in the coming time for all our viewers. And thank you, viewers, for your excellent participation in today's session. To get latest update on how to keep your skin healthy, do like, follow our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you. Thank you.